Hello, my name is Rose Ferdinand, and I'll be presenting my project on central line infection prevention. According to recent studies, central line associated bloodstream infections are one of the most frequent causes of healthcare associated infections within the healthcare facilities. It not only negatively impacts the patient, but the hospital as a whole. The incidence of CLABSIs can be reduced, I do believe, with training of the nurses and also education. Currently, we have for the fiscal year 3 CLABSIs, and we are trying to reduce and prevent any more incidents of CLABSIs within the unit. Upon completion of the training, the goals to acquire will be for us to decrease the number of CLABSIs within the department by 5% from last year's number. We are going to be implementing a lot of new training and processes that the central line team will be implementing. Also, we will try to acquire no more than 11 central line bloodstream infections within the unit. This is going to be a goal for us to obtain, and I know by implementing all of the changes that we will be implementing will actually help in this effort. Another goal will be to increase the rate in which we remove central lines. This is becoming one of the major issues we're having here on the unit. We are now noticing that central lines are remaining in patients way up to and after being transferred to the step-down unit. Currently, we are leaving the lines in just too long. If a patient has done or completed a course of medication that required the central line, the line should be removed as soon as possible. So we want to increase our rate of removal by 10%. Objectives for the staff nurse will be to correctly identify 5 different types of central lines. We are currently using within our department PICCs, dialysis catheters, trialysis catheters, and central venous catheters and ports. So I think by knowing what the line is, it would help in the removal rate. Once you know what the line was intended for and the course of action has been completed, then the line can come out. Effectively verbalize the preferred insertion sites. This is also very important because recently we have had a lot of lines that have been placed in the femoral site, and of course we all know this is one of the least preferred sites. So I think by knowing the preferred site, nurses can be patients' advocates at the time of insertion and just communicate with the physicians and see if there's a better site for the line to be placed. Also recognize 3 major signs and symptoms of infections. This is a basic nursing skill I think that we all should know. So this would be a good goal for us to know once we've completed the course of training. Also, for causative agents, what is causing the central line infections within our department. And finally, efficiently perform a sterile dressing change. This is also very key and a very basic nursing skill. I think that is required by all ICU nurses. Some more facts to consider about central lines is that it is best to prevent the infection from occurring versus trying to cure it. Patients come to the hospital because they're not feeling well. We're here to help, not hurt, and not harm. So I think that the best thing for us to do is to prevent it before it actually starts or begins. And then also we have the different types of causative agents that is causing the CLABSIs within our department. We have Staphylococcus aureus, the gram-negative bacilli, the Candida albicans, and of course TPN. We've noticed have caused several of our infections last year. Okay, like I said, the different types of central lines, knowing what line your patient has can help in removing the line sooner. So if your patient had a PICC line placed for the administration of TPN, once that TPN has been done and the course is completed, the line most likely should be removed. If the patient came in with a port and we accessed the port because we couldn't get access, we need to get emergent line. Well, now that the patient is maybe now they're stable and they have peripheral access, we can de-access the port. If a patient came in and they need to get dialysis, emergent dialysis, and the course of action has completed, they're done with their dialysis, then we should remove the perm cath or the vas cath. Same thing for central venous access. If the patient needed it for administration of pressors or whatever the case may be, and they're not stable, then the central line should come out. So knowing the types of central line is very important as well. And these are the different types of central lines here that we mentioned before: dialysis catheters, tunnel ports, subclavian central lines, and also PICC lines. So I just wanted to put some information on this slide to show you what's going on within our department. Within the past 3 to 4 months, we've had 3 collapses, and we're still waiting on the data from March. So it could be more, or hopefully there's not more. But as you can see, we've had a collapse in each line, each device: a PICC line, a dialysis catheter, and a central venous catheter. And these are the causative agents that we talked about before. So this is much too much. We need to get our hands on this, and we need to start our process of preventing these central line infections. So this is our prevention plan. So what we're going to do, we're establishing a central line team, which is why all of you are here on the call and taking part in the training. The team will perform daily central line dressing changes and audits. So auditing a line would basically mean going to the patient's room, looking at the dressing, and determining if the dressing needs changing, educating the nurses, and just doing things that will help combat the rate of infection. So the team would also train new hire nurses on the importance of collapses and preventing collapses. The training will include the importance of hand hygiene when handling central lines. We know hand hygiene is the key in preventing all types of infections. Noticing when dressing changes are indicated. Always being at bedside when central lines are being placed, because we are the doctors, the physicians second hand. If they need something, we can help and assist them. Also, we're going to be auditing the rooms, like I said before, making sure the tubings are labeled and the dressings are clean, dry, and intact. And also, we're going to be doing one more very important task or skill, which is going to be auditing the patient's MAR, their medical record. If a patient is no longer receiving that medication that required them to have a central line, then we have means to discuss it with the provider to see if we can get the line removed. Okay? So now we're going to be talking about assessing dressing status. So on the screen, you'll see where we have different causative agents or different ways that bacteria enters into the body and causes infection. It can be on the skin. It can be at the port side. It can just be us and the way we're handling the central lines. So what we need to do is we need to learn how we can implement new techniques and not be helping or assisting the bacteria get into the patient. So we're going to be assessing the dressing status. So making sure it's clean, dry, and intact. The biopatch is not saturated. And also that the dressing is not wet. If all of these things are not done, then we are looking for an infection. So typically we want to change the dressing if we notice that it's soiled. Okay. Okay, again, I said we're noticing the signs and symptoms of infection. Increased redness, drainage, pain, warmth, swelling. And also the patient may be distributing signs of a fever. Also, the link here will provide you with a video of performing a sterile dressing change. So these are the key steps to collapse prevention also. We have hand hygiene. Cannot stress that enough. Hand hygiene is very important. Immediate removal of central lines when no longer indicated. Scrubbing the hub for 15 seconds before initiating any type of care with the ports on the central lines. Replacing the needleless connectors after using it for blood sampling. And always ensure that the dressing is clean, dry, and intact. Another very key factor here is ensuring that the patient receives a daily chlorhexidine bath. There have been numerous studies that have shown that patients that receive CHG baths have less CLABSIs. So we're going to do training with not only the nurses, but also with the nurse assistants as well. So this concludes the training. Our goal for the fiscal 2021 is to provide the best patient care that we can and helping to prevent the spread of CLABSIs within our healthcare facility. Thank you.